Hi everyone, welcome back. So today I am going to be doing a sort of a continuation from my previous post on the colour of your urine and what that means. I must just say I've got people drilling outside, so apologies if you can hear any drilling in the background. For this video I am actually going to be talking about the colour of your poo and what that may mean for your health. Now, usually when we go to the loo, we often look in the toilet bowl to see what we've produced. Maybe some of you don't. We naturally assume that it's going to be brown. But actually there are quite a few occasions when it may not be, and your poo can in fact be all sorts of colours of the rainbow. So you can see here there's quite a range of colours: brown, green, yellow, bright red, dark red, white or clay coloured, and even black. So we're going to be talking about the causes of these different colours, and so that you can recognise when you may need to be concerned. So minor changes in the colour to your poo may happen maybe due to changes in nutrition or potentially medication. But just every now and then the colour may indicate that there is some kind of health issue, maybe quite a serious digestive issue, that you need to seek medical attention for. So first off, let's talk about brown poo, because that's what we all expect. So generally your poo would be a shade of brown, again depending on what food you've eaten and also on the amount of bile present. Now, so bile is produced by the liver, and it is needed to help digest fats in our diet, and the bile will contain two pigments called bilirubin and biliverdin. So basically that's red and green. Now, if you were paying attention at school when you did about mixing colours, red and green makes brown. So if the levels of those two pigments and the amount of bile being produced is where it should be, then hopefully we will have a nice healthy brown poo. But sometimes changes in the digestive system may transform the poo to maybe more of a yellowy green colour. When it comes through the small intestine, if you've ever seen the contents of an ileostomy bag, it's actually quite a dark green, and that's because these chemical changes haven't taken place. When it reaches the large intestine, this sort of yellowish green poo is then turned into brown through these chemical changes that happen in the digestive system. Now, green poo, let's talk about that first. So your poo can range from a sort of a real vivid green to just a sort of a slight hint of green, and in a lot of cases this can be entirely normal. Certain foods and supplements may produce green poo. So a lot of green vegetables, for example spinach or kale, or anything with green food colouring, so that may be maybe soft drinks or ice pops, something like that. But also iron supplements can turn your poo green. Now, if you have green diarrhoea, then this probably means that the food has travelled through the digestive system too quickly. meaning basically that the bile has not got time to turn the poo brown because those chemical changes are not taking place. And as we've said, this makes perfect sense because if you've ever seen an ileostomy bag, which is emptying contents from the small intestine, which is higher up in the bowel, it's usually a dark green. So, and that's again, you know, it's not undergone those chemical changes. Now, I'm actually quite fortunate to have witnessed the contents of an ileostomy bag firsthand, because on, I think it was my first week as a student nurse, I actually had a very full ileostomy bag burst all down the front of my scrubs, and I can tell you it's definitely very acidic and very dark green. So that is why you might have green poo. So most of the time, not too much cause for concern. Now the next colour we're going to talk about is yellow poo. Now sometimes the poo may appear to be more yellow than brown, kind of like the poo that you get with breastfed babies. And there may actually be medical reasons why this happens. It's probably not just that you've eaten too much sweet corn. Firstly, if you have celiac disease, so if you have an intolerance to gluten, yellow poo may occur where your body sort of is unable to process that gluten. Also, if the poo is also quite greasy and sort of really quite foul smelling, it may be that it contains too much fat. And this would be due to some sort of digestive dysfunction, or maybe some sort of issue, you know, with the amount of bile being produced, because as we know, bile helps with the metabolism of fats. And this is why people who have issues with their gallbladder will often have fatty poo. And I'm going to go on to talk about that a little bit later in this video. So that's yellow poo. Now, sometimes we might have white or just very pale or clay coloured poo, a bit like those when you see those dog poos that are sort of, you know, a bit sort of dried up, and you know, you can sometimes sort of see ones that are completely white. Quite often this may be due to some sort of medication. Pepto-Bismol is a classic culprit for white poo, or the barium that you would maybe need to drink prior to an x-ray of the upper digestive tract. But also this can occur again due to lack of bile in the poo, and if there's lack of bile, then obviously, you know, there's the lack of those two pigments, the bilirubin and the biliverdin, which give the poo its colour, hence why it is so pale. Now, bile, as we've said, it's produced in the liver, stored in the gallbladder, and then released in the small intestine to help digest the food. Now, it may be prevented from being incorporated into the poo by either liver disease, and particularly we're talking something like hepatitis, or potentially if the bile ducts are blocked, maybe due to gallstones or possibly a tumour or something called biliary atresia. Now, therefore, if you are getting fatty poos, or if you are getting a change of colour that seems to be kind of, it's not just a one-off, you know, you should really sort of just see your GP and get that checked out. Now, okay, so the next one we're going to talk about is black poo. And if you have ever been in hospital, maybe with some sort of bowel issue, and your poo is either black or a very, very dark red. You may hear it being referred to as melena, and that's often when it's sort of more towards the sort of diarrhea-y side as well, sort of thick diarrhea. Now, it's normal for baby poo to be black in the first few days of life. This is known as meconium. And quite often as midwives, you know, when the waters break, you know, that's one of the things we look for as a sign of possible fetal distress, because if there's, if you see that meconium, that black in the waters, then obviously that's a sign that baby has pooed itself, potentially due to being under stress. In the rest of us, however, black poo, it could indicate, again, dietary, eating a very dark food, something like licorice or possibly blackberries, or maybe we're taking a medicine or some sort of supplement such as iron. Iron is well known for causing black poo, and that's, you know, that's nothing to worry about at all. However, if you have black poo that kind of, and again, this is that sort of melena type poo that we're talking about, that it sort of looks kind of like tar, this can actually indicate bleeding in the upper digestive tract, which is more serious, so you need to seek medical attention. Now, this may be caused by maybe bleeding from stomach ulcers, if you've got something like ulcerative colitis. Maybe you've got had sort of severe acid reflux and you've got sores in your esophagus, which is the tube that the food goes down, and maybe those sores are bleeding. Potentially you may have bleeding from non-cancerous tumours in the gastrointestinal tract, or of course there is that possibility that you could have cancer. So if you don't think that your black poo has come from something like your diet or an iron supplement, do just make an appointment with your GP, so that you can just know if there is a problem and get it sorted as quickly as possible. Now, so obviously black poo, as we've just said, can indicate bleeding. Red poo, again, like with the black, it can be an indicator of just certain foods that you've eaten, such as beetroot is the classic one, even tomato soup or some gelatin desserts or red drinks, again with those colourings, may turn your poo to a red or even pink colour. But alternatively, of course, the red that you see may be blood. If it's bright, you know, fresh, bright red blood, it's probably not anything to worry about. You've probably just strained a bit hard. Maybe you've got hemorrhoids, you know, but it could also be bleeding from the lower digestive tract, again, due to non-cancerous tumours, hemorrhoids, which we've mentioned there, inflammation of the colon or colitis. Maybe you've got sort of polyps or some sort of growth in your colon. Irritable bowel sometimes can cause a little bit of fresh blood, and also something called diverticular disease, which is basically where it's often caused by too much straining and constipation. So you get these sort of small sacs created in the wall of your colon. So they're the main reasons why you might have, you know, sort of fresh blood. Now, if the blood is a darker red, then you definitely want to get this checked out, because this can be an indicator of cancer. So, you know, do discuss this with your GP. Now, possibly a slightly more unusual colour that people don't think of is orange poo. Now, sometimes, obviously, if you have diarrhoea, it can be a bit more towards the orange end of the spectrum. And also with diarrhoea, the poo will usually, because it moves through the bowel so quickly, it will usually exit the body pretty much the same colour that it went in. So it's most likely due again to diet and eating some kind of orange food which have a high content of beta carotene. So we're talking about things like carrots, sweet potato, pumpkin, butternut squash, or again any of those foods such as soft drinks or sweets or gelatin desserts that may have a lot of orange colouring in them. But also some antibiotics and antacids which contain aluminium hydroxide may turn your poo orange. So, generally, if your poo is a different colour, it's generally something pretty normal, such as diet or medication. But if it's white, bright red or black, or certainly, if there's dark red blood in there, and you don't think it's from something you ate, do speak to your doctor. And in terms of, I'll just talk briefly about the texture. So a lot of you may have seen, the Bristol stool chart, which is what we use as nurses, where you've got the different types of poo. So I'm going to show you that now. So you can see here the 7 types of poo, ranging from type 1, which is that really constipated, those little pebbles that are difficult to pass, going right through the sort of harder, bulky poo to a type 3 to type 4, which is your ideal poo that you want to have, that's easy to pass, going up through the type 5, 6, 7 into the diarrhea end of the spectrum. And as you can see, sort of quite often with that type 7 poo, it may be a lighter colour, which may reflect, as we've just said, whatever you ate that has moved through the bowel really quickly and therefore not had time for the bile to bring about those chemical changes that give the poo its colour. Okay, so I am now going to talk about something called steatorrhoea, which we mentioned briefly there a little earlier on, which is basically greasy or fatty poo. Now, I always remember a funny story I was told when I was a student nurse by one of my lecturers, and she had a friend who was being investigated by the hospital for some gallbladder issues, and she was asked to take a stool specimen to her appointment, but she had basically failed to realise that she'd misplaced the specimen jar, and wanting to ensure that she had everything that was needed for the appointment, she carefully wrapped a rather greasy poo in some tissue and popped it in her handbag. And she started walking up to the hospital, and it was rather a hot day, and this obviously did not help with the rather foul odour being emitted from the poo. But she got part way up to the hospital and was actually mugged, and the thief ran off with her handbag and her poo. So I think he probably got a lot more than he hoped for that day. But anyway, So greasy poo, what causes it? Well, a high percentage of our poo is water, but it also contains quite a few other things. So obviously bacteria, fats, fibre, mucus, proteins, salts, various sort of linings from our body's cells. Now, if there is too much fat in the poo, this is called steatorrhoea, and it may indicate that you have some sort of malabsorption problem. Possibly your body isn't absorbing nutrients properly, or your body isn't making the enzymes or the bile which is necessary to digest foods and certainly fats effectively. So if you have steatorrhoea, your stools will be probably a lot bulkier. They may be pale, probably quite foul smelling. They also have a tendency to float because they have higher gas content, and we see this with people in IBS quite often. They'll leave floaters in the toilet, and that's because of all the gas. But also with steatorrhoea, the poo tends to be coated in a sort of a greasy film, and you may even notice like sort of drops of like oil or fat in the water beside the poo. So other common symptoms which would also indicate malabsorption, if you're also getting abdominal cramps, diarrhea, gas, indigestion, possibly weight loss, all of these things will also indicate malabsorption. Now, if the digestive system isn't breaking foods down properly, then the body may not absorb, dietary fat, or possibly some other, parts of the food as well. And there are various medical conditions that can actually sort of increase the risk of this. So things like cystic fibrosis, chronic pancreatitis. Obviously the pancreas releases enzymes which also help you digest fats, proteins and carbohydrates in your small intestine. So obviously with chronic pancreatitis, if you're not getting all those enzymes released, there's going to be issues with digestion. And also exocrine pancreatic insufficiency, sometimes known as EPI, and this is where the pancreas doesn't make or release enough enzymes to break down the food and absorb the nutrients. There's also something that we mentioned earlier called biliary atresia, which is basically a blocked bile duct. Celiac disease, which we also mentioned, where you have a sensitivity or inability to process gluten. Crohn's disease, lactose intolerance, and also something called Whipple disease, which is basically a bacterial infection of your digestive system, affecting how the body will break down fat and carbohydrate. So so as we've said, if if you're getting some of these symptoms, or if your poo floats or appears greasy, pale, or unusually foul smelling, then it's time to speak to your doctor. And even more so if you are getting unintentional weight loss or abdominal cramping. So that basically is how to identify any health issues just from looking at your poo. So I hope that's been helpful, and you can also, as I say, look at the video that's already up on colours of your urine and what that indicates. And I am also in the next day or so going to be putting up a video on the colour of your menstrual blood and also the texture Yes, I do get asked these questions. So do keep an eye out for that. You can of course subscribe to my channel and you'll be notified when any new videos come out, or do feel free to leave a comment down below, or you can contact me through my Facebook or Instagram pages. I'm on there as the Medical Massage Lady, and I will come back to you. But yeah, that's really it. In addition to seeing obviously the videos on here or the posts on my Facebook page, you can also soon see all this information on my website, which is www.themedicalmassagelady.co.uk, or if you are a massage therapist, do take a look at my website for training courses, which have more of a medical focus. So that is www.medicalmassagelady.com. But for now, that's really it from me. So do go and check out what your poo looks like, and hopefully it's all normal. But until next time, take care.